Welcome to the Beyond Physio Podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community.
Welcome to the Beyond Physio Podcast. I have a lovely guest here today. Her name is Sarah. I'm going to introduce myself first. I'm Dr. Alex. I work here at Next Level Physio in Montclair, and I am a pelvic floor specialized physical therapist. And I'm going to let Sarah introduce herself. So go ahead.
Thank you, and thank you for having me.
Of course.
My name is Sarah. I'm a coach and personal trainer at Rise Fitness here in Bloomfield, so local. I specialize in women's training, and part of that is prenatal postpartum. So I think a lot of our discussion will be around that today.
Yeah, for sure. So before we dive in, let's just give an overview of what we're going to talk about today. So I want to learn more about your journey and how you started, training postpartum and pregnant clients and, how that's different from just the average active adult. And then we're going to talk specifically about the pelvic floor. So, how you talk to your clients about it and how maybe some of your training changes or some of your, prescription of training changes from pregnancy, postpartum, and how you help guide women through that. And then we'll talk about common misconceptions because we know all of those myths out there. We want to bust those myths because we both know that strength training is super important and not scary for pregnant and postpartum clients. And then, we'll just have a nice discussion and chat about any case stories that we have, and then we'll wrap it up.
All right. Sounds great.
So let's start. So tell me a little bit about your journey and how you started doing all this.
So this is not where I started. I had a whole different life before I had my own two kids. So I have two children, 10 and 14, and I think that's kind of where the story starts. It's my pregnancies. Even though it was 14 years ago, nobody was telling me to exercise. Definitely not strength train. It was more like take it easy.
Yeah.
Which really is not what I should have been doing. And I did work out for a good chunk of my pregnancy with my first, and then I kind of dropped off probably 6 or 7 months into that. So through my experience, I had a okay pregnancy, but difficult labor and delivery. Second pregnancy, labor and delivery, which were much better, but I learned from that experience. And then also just kind of educating myself on women's health and getting to know more about our bodies and what we truly need. And then being surrounded by other women who have gone through the prenatal postpartum experience, I just felt this need to do more.
Yeah.
So I decided to become a personal trainer. And then through working with so many women at the gym, it was like such a need for it. And then in the space I was in, there was nobody filling that void. So that's when I got certified and decided to take on that role. And since then, it's been a blast. I'm learning all the time, but also just seeing really great results for women.
That's awesome.
Yeah.
What, other than, your own personal journey, what kind of gaps did you see, in traditional strength training that weren't necessarily like catering, the pregnant or postpartum client that, you find that you're more equipped to help people with now?
I think the first thing that comes to mind is just modifying.
Yeah.
Knowing when to modify, how to modify, specific to the pelvic floor, like how to coach a woman through their breath.
Yeah.
How do we breathe through a movement? How does that change once we become pregnant and throughout each trimester?
Yeah.
Does it change? Coaching through loading, changing our load, just being aware of what a woman needs through pregnancy.
Yeah.
And teaching her those things, because a lot of women know to lighten the load, but they don't know everything else they could be doing better.
Yeah. No, I totally agree. I do not have children, so that's not how I got into this. However, I've been a physical therapist for 5 years now, and a lot of my friends are, pregnant. They're starting to have kids, and a lot of my friends from PT school obviously are physical therapists, but none of my friends are specialized in this area. But I am specialized as far as, or I was before, training more athletes, but I didn't have that pelvic floor component. And I had so many women, adult athletes, even 10 years postpartum, and I would, they'd be coming in for Achilles rehab, and we'd be getting to the point where we'd be doing pogo hops, and they're like, oh, I can't jump because I'm going to pee my pants. Yep. And I'm like, oh, like, I don't really know what to do with that. And I was like, this is such a big need for women. But unfortunately, like, a lot of people don't even know that pelvic floor specialists in training and pelvic floor physical therapists even exist.
Right.
You know, one of my major goals, you know, over the next 5 years is to educate OBGYNs and doctors on who we are and how we can help, because I think every single woman who is pregnant and postpartum should have to go to physical therapy or should want to go to physical therapy and know that they have access to it, because it helps them so much. And as women, we are, you know, go, go, go all the time. And we like to take care of a lot of other people. And I find that, you know, people trying to kind of just like, oh, like, it's fine. Like, I'll just, you know, wear a pad so that, you know, if, you know, when I jump and I leak, it's fine. And I'll take care of it at some point. And also, you know, a lot of women experience back pain, and it might not be until 5 or 10 years postpartum. And, you know, they're going to regular PT and, you know, they're doing all the things, you know, they're doing core work. They think they're doing all the right things, but that back pain won't go away. And what's that missing piece? And a lot of the people that I've, you know, treated and have had experiences with since becoming pelvic floor certified is that it's the pelvic floor is the missing piece. And like you said earlier, a lot of it is about the breath, and we'll definitely get into that and how the breath and the rib cage and the pelvis all are integrated together. So I think we're definitely aligned on those things.
I think to your point, I still work with a lot of women. We're just used to like dealing with things.
Yeah.
And it feels just like one more thing we have to add onto it. So we just won't do the jump rope today, and we'll just, you know, cross our legs when we have to sneeze because it's not that big a deal.
Right.
But I think there's like a short-term investment to living a life without those worries and without having to avoid things. And if we could get more women to just take the time to go see their physical therapist. And a lot of those women are already doing strength training.
Right.
But I think in addition, physical therapy is a nice complement to that is lacking for a lot of the women I work with. I mean, just today I coached a class where I had women joking around about how they couldn't jump rope. They were doing toe taps instead because they were, you know, peeing their pants. So it's super common.
Yeah.
I do think there's more conversation around it, and it's really a good time to be doing what we're doing.
100%. And I say it all the time, you know, when I educate people, it's common, but it's not normal, right? Just because you or your friends or you see it on the internet, or even if you tell, you know, your doctor, you know, they're like, oh, you know, that just happens. You know, it's not normal. And the good thing is that it can be fixed, you know, it can be addressed, and you don't have to live with that forever. And that's the message that, you know, that's my goal, and I'm sure yours too, and why you do what you do. So I'm glad that, you know, we're both on the same page. We both have the same goal. But before we get excited and dive in further, I just kind of want to set the stage. So I kind of want to explain what the pelvic floor is, because a lot of people just think it's, you know, one muscle or it's just doing Kegels. And obviously we both have the education that it's not that. So I brought my handy dandy pelvic model here. So I'm going to start with like what I would think the pelvic floor is. And then obviously I want you to chime in too, because I'm sure you have a different perspective of how you view it. So when I explain what the pelvic floor is to clients, I say it's kind of a hammock. So it's a support underneath the pelvis from the pubic bone all the way back to the tailbone. And it's not just internal. So it's not just inside, and it's not just outside. It's a combination of both. There's 3 layers, and it also connects. On top of this is your diaphragm and your rib cage and your core. And on the outsides of it are your hips, which include your glutes, your adductors, you know, all of these major muscles that we train all the time, but we don't ever really think about the pelvic floor when we're specifically strength training. So I think when we put it into that context, it makes sense. Oh, you know, when I'm doing a squat, when I try to come up, I know it's working my legs, but I, you know, have a hard time. I pee a little bit, right? Yeah. Well, that's because your pelvic floor is being affected at the bottom of the squat, right? As we can see in this model, it also holds very important organs, you know, your bladder, your rectum, your ovaries. It's involved in sexual function and all of those things involved in strength training. So I find that the best thing to start with clients is to educate, because a lot of people, even if they've had children, they don't even know these things, that there's layers and, you know, all of these things that can, and I find education is so powerful, because if people understand what's going on with their bodies and why it's happening and why we're modifying a specific thing during training or why I'm prescribing a specific rehab exercise, they're so much more invested in it and they really understand. So that's kind of my perspective on the pelvic floor. Is there anything that you would like to add?
I think everything you just said obviously is what it is.
Yeah.
It's just this muscle that's, gets not a lot of love.
Yeah.
But does a lot of work for us.
Yeah.
Right? I think that's my point of view, is that it does a lot of work when we're walking, when we're squatting, when we're deadlifting, all the movements we do throughout a day outside of the weight room it's working for us, and it gets compromised through pregnancy just naturally. So the things we need, what I do is work through strength movements that can help strengthen it or activate it in a way that helps to strengthen it.
Yeah.
So everything you said it's spot on. That's what it is.
Yeah.
But my approach is a little less. It's this muscle
that
we need to give more love and attention to and care for, because it works really hard for us.
Yeah, 100%. And I think the biggest thing also that people don't even know is that it contracts and relaxes like every other muscle, right? So as a pelvic floor physical therapist, seeing more of the rehab side of it, a lot of times I have clients come in with incontinence, meaning that, they pee their pants when, like we've talked about, when they jump, or, they can't make it to the bathroom on time. So then they leak a little bit. And sometimes that muscle doesn't know how to relax all the way. Just like, if you're doing a bicep curl, right? If you can't extend all the way, like we know in strength training, then you're not going to be able to utilize the muscle through the full range of motion. So I also like to explain it like that so that people understand sometimes why we start with breathing. Because if someone comes in and they're like, I have leakage or pelvic floor pain, or, I'm pregnant, like, why am I doing breathing exercise?
Right.
Like, what does that have to do with it? Right. And I use breathing a lot to help just relax the muscles and down train, tell the nervous system to calm down. So I think that's also really important to teach clients on too, which I'm sure you agree.
That's great. My approach towards breathing is actually more based in the movement itself.
Yeah.
So if we have someone back squatting or squatting in any way, typically in the first trimester, there's not a lot to change.
Right.
As the belly grows, then we start to think about modifications we may need to do. So if I have someone squatting, it may be a matter of take your breath in, go down into your squat. When you're at the bottom, now let's exhale all the way up.
Yeah.
Right. And that works for a long time for a lot of women. Most women can get through their pregnancy. They're doing just that.
Yeah.
But for some, if they feel like they're putting pressure on their pelvic floor, or like they're bearing down as they're coming up out of the squat, I may encourage them to breathe all the way down, breathe all the way, like exhale all the way down, exhale all the way up.
Yeah.
To relieve some of that pressure they're putting on it.
Yeah. And I think that's one of the biggest things that I learned while getting my specialization is that there's different types of breathing that can help people manage those complaints or symptoms that allows them to train through pregnancy, right? It's not just all or nothing. If you have discomfort or pressure or whatever the symptom is, you don't have to just stop, right? Yeah. We are able to, take that information in and then change, there's a million different things that I've learned that you can change, intensity, volume, range of motion, breath work,
exactly.
Which I'm sure you deal with every single day.
So for me, there's the breathing piece, but the more obvious one is lighten the load. Don't make it so hard. You're not here to hit a PR. You're not here to prove anything. You're here to move, keep moving, feel good, come back tomorrow. And that kind of goes for anybody, but especially during pregnancy.
Yeah.
And then you get to a point where some women do need modifications in more shallow squats, more elevated this or that, depending on what the movement it is.
Yeah.
So there's breath work, there's managing load, and then there's managing the movement itself and the range of motion through it.
For sure. One of the things that I learned in one of my recent courses, which actually wasn't even for physical therapists, it was for trainers, it was pregnancy, postpartum athleticism is what it was called, and was dealing with people who come in who have this athlete brain, and I'm sure you see that all the time. And I know that I'm going, because I would like to have kids at some point in my life. I know that I'm going to go through it because I go through it myself, even when I have an orthopedic injury, like low back pain. And it's this mindset that we have to train hard, 100%, sweating like a maniac, burn so many calories. Like we all have our watches that are tracking all this stuff every single day. And obviously that's something that, we kind of, that I find like setting the stage with, even with my clients who come in postpartum or, pregnant for rehab purposes. It's like, listen, this isn't like what you said earlier. We're not like, we don't have to PR right now. Right. And I'm sure, what's your perspective on all that?
So that's actually a lot of what I do, especially my classes when I have pregnant women. It's a reminder of, I'm watching them on the rower. What do we do? We're not proving anything today. We don't need to do this today.
Right.
I want you to come back tomorrow. I want you to feel good.
Yeah.
So sometimes it's just a reminder that, now's not the time.
Yes.
But then there's the other end of the spectrum too, where the women that know they need to exercise and they're here because they know it's good for them during pregnancy, but they're scared of everything. And it's teaching them and showing them and guiding them through, you can do more than you think you can. And you should do more than you think you can. So there's like the two ends of the spectrum of
100%.
Managing expectations either way.
Yeah. Managing expectations. That's and goal setting, right? That's such a big part of what we both do probably. I was coaching a class last night and I had someone come up to me in the middle of class and she said, I'm pregnant. And in the class, there was program sled push and sled row back. She's like, I don't want to do that. It doesn't feel safe. And, in my head, there's no specific reason why you can't do that, especially if you've been coming to class, throughout your whole pregnancy and you have some sort of foundation. We just might not want to put any weight on it, like see what you're comfortable with. But I like to kind of take the fear out of it in whatever way that makes someone, obviously if someone's not comfortable, we're not going to push them. There's no benefit to that because then you lose the trust and then they're not going to come back, which isn't the goal. But I think a big misconception is that like, it's not safe to train when you're pregnant. And I think maybe in both of our niches, we see more people training during pregnancy.
We do, yeah.
And, I see physical therapists that are, about to give birth next week and they're doing cleans with barbells. And I'm like, that's awesome. But a lot of people would look at that and be like, that's unsafe. Or even if you look at the comments, that's not safe. You're hurting your baby. And it's just not true. Do you deal with a lot of women who, how do you kind of train around or help coach people through like being nervous about doing things or kind of dealing with some of those misconceptions?
So I think there are people, pregnant women that I work with that will do cleans as long as they can. But they have been doing cleans for a very long time. Right. They're very aware of their bodies. They know what they're doing. If anything, we need to manage the load more than anything. The movement, they know. But the women who are scared of things, first of all, I'm never going to make you do something you really don't want to do while you're pregnant. I just won't. But I will start with the easiest version of it. Yeah. And we'll work our way through it. And then it's educating them. Well, why are you afraid of that sled push, the sled pull? Like, what about that do you think is going to be bad for your baby? Yeah. Or bad for pregnancy? Right. Actually, no, these are the muscles it's working. It has nothing to do with that. So those kinds of things, just educating them on that. But always the ultimate goal is I want you to feel safe with me. And if you really don't want to do it, then we're not going to do it. Right. And then I also had a client who came to me. It was her second child. Her first pregnancy, she had a lot of pain. She worked with a personal trainer via Zoom. And she would say, she'd be back squatting and she'd tell the trainer, this hurts. And she would say, it's okay. Just keep going. And then she ended up being in a place where she couldn't even walk. Oh my gosh. She came into her second pregnancy. She was really scared that was going to happen again. And she's a person that's pretty intense and really likes to work out. She was active. She didn't go into her pregnancy sedentary. Right. So it really bothered her that she couldn't move. So she moves really well, but we took it slow. We worked through things. We addressed the issues. She had a lot of groin pain with the first pregnancy. My whole philosophy is if you're in pain, we're not doing it. Right. Right.
What's the point?
There's no point in pregnancy in anything. If you're in pain, you shouldn't be doing it.
That saying, no pain, no gain. I hate that so much.
Yeah. And so we're not going to do it. I'm not going to force you to do anything. We'll just modify. Right. If you come in and through pregnancy, every pregnancy is different and every day is different. So I could have a program designed and they'll come in and they'll say my back hurts or I didn't sleep well or I just don't feel good. And I will modify on the fly.
Yeah.
Right. We'll make changes based on how they feel that day. And that's part of how we keep them feeling safe.
Yeah.
Right. Is because we're addressing how they feel and acknowledging that that's what pregnancy is.
Yeah.
And the most important thing is to keep you coming.
Yeah.
And to get you so you feel better for tomorrow. So I think that's the whole goal, is to help them feel safe, modify as you need to. And every woman is different.
Yeah.
Some need a lot more and some just, work up to the end and have the baby 2 days later.
Yeah.
It's all dependent on that woman.
Totally. I totally get that. And, a lot of, obviously as a physical therapist, most people come to me because they are having an issue, right? Whereas you probably are seeing clients who are pregnant and are fine, seeing both sides of it. People
Right.
who are modifying because they're in pain, and also people who are fine. But a lot of what I explain to people is not necessarily that pain is normal, but it's very common because when you're pregnant, your ligaments just, all of that ligament laxity, right? It's just the the body's natural process of making room for the baby, right? So if everything's getting loose, a good way to counter that is to strength train in a certain way, right? So like if the groin is like a big one, right? Because the pelvis and it's holding all of that pressure. And if we can find an entry point into some sort of, even if it's a bridge with a ball squeeze, right? Like an isometric.
That's my favorite.
Yeah. I love starting with that one because it's such a great entry point into doing something. And then someone feeling like they made a big win because they're able to move and not have pain and they're able to train around it. Right. So I think, not necessarily saying that, you should just keep going if you have pain, like what you talked about previously, but like, it's a pretty common and, thing during pregnancy.
Yes.
This is how we can, move around it, and this is how we can address it and, kind of modify the game plan on the fly if needed.
Right.
And that's where I'm sure your specialty comes in super handy when you're working with a lot of different pregnant and postpartum women.
Right. So I certainly have, I'm a strength coach. I'm not a physical therapist.
Yeah.
Although some people like to treat me like I'm a physical therapist, and I like to remind them, no, if you want to, go to next level.
Yeah.
If that's what you need.
We appreciate that.
Not me. I'm not it. I'm a strength coach. So my approach is always around movements that build strength and, specific to the pelvic floor. How do we get it active and strengthen it through activation through these specific movements? So that glute bridge is my go-to. It's one of my favorites because I feel like you can get so much out of it, especially with a prenatal client. Like you said, put the ball between your knees, squeeze it actively, and you can progress, modify it as you need to for that specific person.
Yeah.
We spend a lot of time on adductors.
Yes.
A lot of time doing some sort of lateral lunge or lateral plate slides,
Love
things
that.
like that. And then even doing like half kneeling things.
Yes.
To activate. That's a big portion of what I do with them. Marches is another one of my favorites.
Yeah.
And this is all stuff I'll do prenatal and postpartum.
Yeah.
Marches.
And it's good for people, men too, it's good for everyone.
Men suffer incontinence too,
Yeah.
right?
Men have pelvic floors too.
But marches I love because obviously it activates the pelvic floor. You can build strength in your core. You can build strength in that standing glute, the glute of the standing leg, but you can load it in different ways, right? So like for me, I'm prepping women. I'm working through pregnancy with them, right? But I'm also prepping them for labor and delivery and what comes after the baby is out. And so with a march, I love like a offset.
Yeah.
Right. Put a lighter kettlebell in that front rack position, put a heavier one in the suitcase. And it's like, here's my diaper bag and here's the car seat. So those things and helping them work
functional.
through stabilizing muscles through that. Same with a farmer's carry, kind of do the same thing with them. So like that's my goal, is helping you get through pregnancy, through labor and delivery, and then ultimately like what do you need? What's going to help you after? And recovery too.
100%. What would you say to someone who, is kind of sedentary, like before they get pregnant, but then, they're on this health journey because they want to conceive naturally and they do get pregnant and they come to you and they want to start strength training. What would be a good place to start? Or like, how would you, do you have clients that are like that? How do you normally start with them?
Yes. So with them, basically I have to have an assessment, see where they're truly at, what their strength level is, how they move. But they're going to be super basic movements, body weight, utilizing bands, light kettlebells, light dumbbells, utilizing suspension bands like the TRX, but really basic squatting, lunging, some form of row, because I like to strengthen the back.
Yes.
Through pregnancy to help with posture, right? And
so many people complain of that discomfort at the end of their pregnancy and postpartum when they're breastfeeding or holding the baby, that, you know, that postural pain.
That's a big postpartum thing, is bringing back the shoulders, stretching the chest out.
Yeah.
But, you know, when they're new to training and they're starting in pregnancy, which I do have those women, so it's great because they know they need to be there.
Yeah.
They're on the right path. It's just taking it easy, starting where they're at, just like you would with any person that comes into your gym.
Yeah.
And then building a program out based on that. And then, like I said, adjusting as needed.
Yeah, 100%. I find that, like, as long as you're medically cleared from your doctor that you're safe to exercise while you're pregnant and there's no high risk to anything, right? And we're safe to go forward, the first trimester is the best place to start, because you're going to have as much, obviously you might have to adjust if you're having nausea or, you know, fatigue and low energy, because like those are common things in that first trimester. But as far as like physically, right, like we don't have that big change in, you know, being our center of mass being pulled forward, because as the belly grows, right, the center of mass gets pulled forward. Our pelvis moves more into that anterior tilt, and that's where more issues can come as far as like strength training, because you're just getting blocked by your belly. And that first trimester, I'm sure, is a great place to start.
That's where you can actually build.
Right.
In that first trimester, you can actually work on getting stronger.
Yeah.
And then you kind of back off on that second and third trimester. You're not trying to get stronger. You're just trying to maintain a certain level of strength and move as well as you can. Yeah. But certainly you can utilize that first trimester to build some strength and endurance there.
For sure.
Yeah.
So a lot of women, at least, you know, when I assess them, they're like, I don't even know how to contract my pelvic floor. And, you know, as much as I hate Kegels are good for everything, people understand what a Kegel,
they know what it
they
is.
Might know, they might think they know what it is. And then when you assess them, they might think something differently. And as a pelvic floor physical therapist, we do internal assessments, which I know obviously in the gym, that's not what you're doing. So when someone's like, I don't know if I'm feeling it, I don't know what I'm doing, like, do you have any go-to cues that you help people try to figure out what that feels like?
I don't know if I have go-to cues. I think a lot of it would be like, I want you to tuck your pelvis or squeeze, like pick your pelvis up almost and squeeze like you have a blueberry.
Yeah.
Right? Something like that. And then when it comes to the core or your abdominal wall, I want you to, it works best when you're actually pregnant. I want you to bring your belly in like you're wrapping the baby.
Yeah,
so
it's a big one. Hug the baby.
Hug the baby, exactly.
Yeah.
And then keep it there, right? I think those are like my go-tos.
Yeah. Yeah. We haven't even talked about the deep core yet, the transverse abdominis and the obliques and all of those muscles and how important they are, you know, to make sure that you know how to use them and that you're doing it right. And you're not, because people just think of their core as like their six-pack muscles, right? That's, you know, when we look at anatomy and, you know, you flip back the layers of muscle and tissue in the stomach area, the rectus abdominis, which are those six-pack muscles, is the most superficial, one of the most superficial layers. There's so many layers underneath. And I find that teaching someone how to contract their TA or how to engage their deep core can be really challenging.
Super challenging.
What do you find is the best way, other than like you hug the baby? Like, do you find, like, how else do you help people work through that?
I think it depends on the position they're in. It's easiest, honestly, when we're on the floor.
Yeah.
So then I can say, you know, connect your spine to the floor.
Yeah.
Don't let your lower back lift here, or, you know, things like that. It's a struggle in the more vertical positions to get people to understand. So for me, I think my go-to is stack the rib cage over the pelvis. Yeah. People tend to understand that and can kind of visually show it. Yeah. And visuals help. That's really those are my go-tos.
Yeah. No, I'm totally with you on that. I think changing positions is great. I love getting people on all fours, especially if they do have a belly, because sometimes when the belly's pulling against the ground, then they can feel that cue of like gravity pulling them, and then when they're contracting it coming up and tightening in. Another one that I've been using recently, and I don't know, I've been playing around with it, but everyone can visualize their six pack, right? So I'm like, pretend like you're bringing your six pack closer together and trying to bring your hip bones together. And sometimes it works, sometimes it doesn't. I always try to, it depends on the person, right?
Exactly.
So I think that's the hardest thing. As far as breathing goes, I know we talked a little bit earlier about, the changing in cues, sometimes breathing in on the way down and then exhaling as you come up, or exhaling through the whole range of motion. Why do you think breathing is so important during lifting in general, and then specifically during pregnancy?
Well, generally, we hold our breath to help stabilize and protect our spine.
Right.
So that's when we're doing a heavy load, our breath work is really important. We hold a breath through the movement and then breathe out as we're coming out of it, right? But when you're pregnant, that can create a lot of pressure on the pelvic floor, and that's something we want to avoid. So our breathing should change if we're doing heavy loads while we're pregnant.
Yeah.
I mean, well, your classes, you're not doing barbell work or anything, but I'm sure you have plenty of women in there that are moving pretty good weights.
Yeah.
And what's your take on it?
So my foundation, and I found kind of like going back a little bit, I was taught as from like a physical therapy perspective of how important breathing is for everyone, right? When you breathe, it, especially for people who are in pain, a lot of times our nervous system is in that fight or flight mode. So everything, like if someone's having a muscle spasm or they feel like they're stiff and they can't move, it's because your nervous system's like, I don't want to move because I'm scared, and they pump the brakes and they tighten everything up. And breathing is kind of a mind trick to relax and to take the brakes off and get that nervous system to calm down. So I've integrated breathing in, my physical therapy practice for years. And when I coach people, because a lot of people don't know when they're supposed to breathe when they move. There's so much misinformation out there. And there's also, like you said earlier, there's different ways to teach breathing, and none of them are necessarily wrong, but they might not be right for you, right? And in a class setting, it's a little bit difficult because there's like a million things going on. But the biggest thing that I tell people is breathe in on the way down and then breathe out as you come up. Another big thing that I tell people if they're having discomfort, a lot of times in the bottom of the squat or the bottom of the deadlift, there's different ways that we can organize movement to stand back up, right? We can use the right muscles like our legs and our adductors and our glutes, or we can use our back, right? We can lift our chest from coming up from a squat or from a deadlift. So a big cue that I tell people is push the floor away, breathe out and push the floor away. I find that gets their feet involved, and that foot connection to the ground really helps engage the posterior chain, so the hamstrings and the glutes, and it also just makes sense with the coordination of movement. So those are my two go-tos of breathing out of the bottom, and at a certain point, breathing through the whole range of motion, like that foundational breath, I find is more helpful. But breathing, the place that I usually start is breathe in on the way down, breathe out as you come out, and push the floor away.
Do a big breath before the descent. Breathe up. Breathe out on the way up. Drive your feet in the floor is something you'll hear me say a lot, depending on several movements. So very similar, because those are cues that just people understand. And
that's the biggest thing.
It holds true. And then in general, people don't know. There is a lot of question, and even a bench press. Well, when do I breathe? So it's talking to each person about that. I love a pal-off press because you can teach people to breathe and inhale, exhale on a pal-off press. And a lot of people, when you're doing core work, like hold their breath. I don't know if you see that, but I 100%. See them holding their breath. So I love the pal-off press because you can teach someone to inhale and exhale through that movement on the way out or on the way in, where the comfort level is for you. But I need you to do one. So if you press out, maybe take a big breath, press out, and then release as it comes back to you. Or vice versa, depending on what feels most natural to them. But it's a good place to coach through some breathing technique.
I totally agree. And I always look at people's faces, because if their face is all red and they're like, oh, oh,
Yeah.
and I'm like, you're not breathing.
Yeah.
You're holding your breath. I'm like, breathe, reminder, breathe. Cause it's very, I think for us, like sometimes, at least for me, like I take for granted all of the knowledge and education and background that I've built over the years of learning and, practicing and training as well,
Yeah.
that sometimes it's very intuitive to me to just do it because I am in this environment all day, every day, right? And for a lot of people, training is 1 hour a day, a few days a week, right? They're not thinking about it all the time. So just that little cue of like, breathe, if they're holding their breath is so helpful for people. They're like, oh, like now it doesn't hurt anymore.
Yeah.
And I'm like, yay, like that light bulb moment for people is like my favorite. So what do you think are, when you're training your pregnant clients, what are the most important muscle groups that you find are important to train during pregnancy specific to help them?
So when I'm working with a prenatal client, I'm very specific and I spend a lot of time on what movements we're going to do because I feel like there's so many things I want to take care of for them. So I always want to make sure we're doing movements that engage the pelvic floor. I want to strengthen the back.
Yeah.
Because they're going to need the extra help to carry the belly as it grows, but also they're going to need that after the baby comes out.
100%.
And then a lot of lower body work and specific like endurance. So building strength, but also endurance in the lower body. Because if you are a woman that has a vaginal birth, you're going to exhaust your leg muscles.
Yeah.
Right. So building the strength and endurance. So that could be like doing squats and then going into a wall sit.
Yeah.
And even with a wall sit, I might put a ball between your legs and have you squeeze through the wall sit. So I try to incorporate movements that we get a lot out of.
Yeah.
Right. So like I said, the glute bridge, squats, different types of rows, marches. These are all things that I think are really easy to fit into a program for most pregnant women.
Yeah.
So I would say we're working the glutes, the lower body, we're working the back, and we're doing things to engage the pelvic floor. I mean, we work on the core always, especially early on. It gets a little harder to do that as the pregnancy goes on.
Yeah.
And then we are limited on what we can do. Like, we're not doing a lot of twisting in the second and third trimester. We're avoiding that. So it's a lot more of like Palloff press, marches, things like that, where we're utilizing our core, but it's more limited than what we could do in the first trimester.
For sure. You talked about strength versus endurance, muscle endurance, and I think that's so important because they're both important, but for different reasons. You mentioned, doing squats and then into a wall sit. How else do you, so one of the things that I do is change the rep scheme, right? Might lower the weight, and instead of it being, if we're doing heavy weight, sets of 6, if we're doing endurance, drop the weight and do sets of 15. So more reps over time, right? Because also, we use our muscle, especially those postural muscles in your back, right? If you're sitting without support or if you're standing and rocking your baby, those muscles, we don't think about it, but your postural muscles are working all of the time. So then if during pregnancy you don't train them at all because, you don't, you're scared or you don't strength train, and then you're doing way more than your body is used to doing, then of course you're going to have aches and pains.
Right.
So what do you do other than what you mentioned earlier to address that?
Wait, are you asking, like, what are you asking?
So like the different, like, how does your training change for like do you do specific exercises for strength and specific exercises for endurance, or do you mostly just kind of mend it all together?
I try to incorporate it all because there's only so much you can get to in the 60-minute session.
100%,
so it has to be very deliberate, intentional. So it'll be mixed in, and maybe, like we said, the first trimester, maybe I'm more focused on strength. Building strength.
100%.
Leading into the second, and then it becomes more endurance, lighter weights, higher reps, and then whatever they can manage themselves on that day, right? Maybe that doesn't work for them, but it depends on where they're at. But I definitely try to make it, like, bring it all together.
Yeah.
So maybe we do, like I said, we do less squats, but we do the wall sit, or maybe today we're going to do sumo deadlifts and we're going to do a lighter weight, but I want you to do a bunch of them.
Yeah.
Right? So it just depends on the person and where we're at in the pregnancy and what works for them. But I am definitely very intentional in how I program for that person. 'Cause there's just so much to do.
Yeah. That's so important. And I think like what we talked about earlier, a lot of times people don't know where to start, and there's so much information out there. There's, YouTube videos for people with pregnancy and all that stuff is great. But, I call it YouTube University, right? People come in, they're like, oh, I
saw this on TikTok.
Yeah, I saw it on TikTok, or I saw it on YouTube for shoulder, even someone coming with shoulder pain. And all that stuff is great. Like and honestly, it's great for me because as a physical therapist, all that stuff gives me ideas and adds more tools to my toolbox because we have the context to sift through that stuff and then apply it to the person in front of us. However, if you don't have that and you're just doing someone else's program that's not specific to you, that you can run into problems that way as well. So that's why I think it's so important to have that one-on-one with someone who knows you, right? Get the assessment. Like you said earlier, it's a small term investment for the long term game.
Right.
And, it's so important to do that because no one is the same, right? Every single person is different. You could be the same height and weight and same time in your pregnancy as the person next to you, and you might need completely different things. You just don't know. So having that specific, trainer who has the specialization, the specific physical therapist who can assess you and give you that personalized program, I find makes the biggest difference for people.
Yeah, I agree. Yes.
Yeah. So you train a lot of clients. Are there any red flags, I would say, that, when someone says to you during training that would make you want them to go see a pelvic floor physical therapist or make them go see their doctor if people are wondering like, well, how do I know when something is bad or good? What are signs that you look for, that you hear that kind of trigger those red flags for you?
So I think there's the obvious. If you can't jump, if you're avoiding jumping, you're avoiding certain things because you're afraid you're going to wet your pants, or you're running to the bathroom to put a pad in, it probably would serve you well to go see a physical therapist.
100%.
Or if you're avoiding, some people can't do kettlebell swings, and we'll modify for you if that makes you uncomfortable. I'll give you something else to do. But maybe you should go see a physical therapist. There's also my approach is, how do you feel the next day? If we do something in here and you don't feel great, but you did it, how do you feel tomorrow? Are you still sore? Does it hurt? If it hurts the day after or 2 days after, you need to go see somebody else.
Yeah.
You need to go get help for that. Again, we're not physical therapists. We want to work together with your physical therapist, right? These two things together can give you so much.
Yeah.
But so basically for me, my approach is there's obvious signs. If a woman's pregnant and she has blood clot, she's bleeding for some reason, we don't need to train today. Yeah. That's not the priority. Call your doctor.
Right.
Most of them would do that anyway.
Yes.
And then there's always how do you feel the day after?
Yeah.
I think that's one of the easiest signs.
Yeah.
Of okay, this is real. If it goes on for more than a day, maybe a day is fine, but if it goes for a week, there's something more to it. Go talk to a physical therapist, have them assess you, see if they see anything.
Yeah.
That's really it.
I'm totally with you on that. And I think the biggest thing that, I don't want to take people out of training, right? One of my major philosophies is to help people train around and train through any sort of symptoms, whether that's pregnancy, postpartum, or any sort of active adult, right? So our goal is to work with you specifically, or whoever their trainer is, to help them through it, right? We don't want to take people out of activity because obviously our ultimate goal is to have people reach their goals, which is train. So I think, if you have any questions, people out there, ask your trainer, ask your pelvic floor physical therapist, ask for a referral, because we can answer all these questions for you. You don't have to live in the unknown. You don't have to use ChatGPT.
Well, the other thing that's super helpful is I have had women who have worked with me and they have a physical therapist. What do you do in physical therapy?
Yeah.
Because we don't need redundancy. 100%. I don't need to do what they're doing. Tell me what they do. They're working on that. We'll work on this.
Yeah.
And vice versa. So that, I had one client, she's very good, the one that was nervous through her second pregnancy. And then she would tell her physical therapist, this is what I'm working on with my trainer. And so it was just working through it together.
Yeah.
I mean, she worked all the way to the end of her pregnancy. I think she took the last 2 weeks off, but this time it was her choice.
It's amazing.
Right? She trained with me. She took our HIIT style classes. She was one that I have to be like, we don't need to work so hard today. Like, you're good.
Yes, there are those.
But through working with a physical therapist and myself, she made it all the way through her pregnancy. And then when she came back to see me postpartum. We did like 5 sessions together, and now she's back in classes. And
that's awesome.
Her recovery was so much faster.
That's amazing.
The first one, she never really got back into it.
Yeah.
So that's just proof that if you find the right place, you put the work in, you do the right things, the recovery will be better too.
Yeah. And it's all about working together, right? Like nothing has to be in isolation, right? You don't have to just go to your physical therapist. It's like not all or nothing, right? It's not physical therapy and nothing, training and nothing, or just nothing, right? Like the goal is to be integrative. And like now in the world that we live in now, like there's so many resources out there to be able to access all of these things. Like let's use them, right? Let's spread the word. Let's have people train through pregnancy. Like it's going to make them stronger, more resilient after, my biggest thing is like after people give birth, because I see a lot of postpartum clients too, is like your body went through a trauma, right? I know it's natural and it is, right? But it's a trauma to the body, right? And you have to let it recover. So I kind of want to transition into some postpartum talk. Okay. What's usually when do you recommend people starting to do stuff? Like, if you see someone through pregnancy and they give birth and they're like, when can I start? They're eager to get back in the gym.
I mean, they need to be cleared by their doctor. Generally, that's like 4 weeks after delivery, longer for C-sections. I want you to feel well. I want you to feel like you can move around in your general life well. When you come see me, we'll do a basic session. That's where I get to assess you again to see where you're at. Because some women come in and they're in a much better place than other women are. Right. And sometimes it depends. I've had women who've had 3 babies. It's been 2 years since their last, and they really haven't trained, and their core is super weak. Yeah. And then I'll have a woman that's 4 weeks out, and her core is in a much better place. Right. So, but that's a person that trained all through their pregnancy. Right. So it's where are you at? So I assess a core is the biggest assessment I do because it's so integral to everything that you do in any movement. And I can really tell through a dead bug where you're at. Yeah. That's the easiest sign is like, what do you look for in that movement? So, we want to keep that spine down, connected to the floor, keep your lower back down. We don't want to see any coning. Yes. How far can we extend our leg without any coning, without the lower back lifting? Can you explain what coning is, just if people don't know what that is? So it's like that dome in your belly that you'll see, just kind of that rounding out dome-like shape. Yeah. Is when you put pressure there. So in a dead bug, that's like when you extend your leg straight, and if you try it, how far can you reach it before you see that coning? Yep. Right? So that's a good assessment of where they're at core-wise. I'll look to see how well they're moving, if they're struggling through a movement. If we're doing a squat, how hard does it feel to them? And then how much time do they need to recover? Yeah. Right. Most women, by the time they come to me, they're in a pretty good place. Yeah. But it's also, we'll have women jump back into class, those intense athletes. And it's like they forget, no, you're not pregnant and you feel pretty good, but you just did go through that traumatic experience. Yeah. So your core is not what you think it is today. Yeah. You really should be modifying. Right. And I know you want to keep up with everybody else, but that's not where you're at today. You need to start with the basics. You need to do your dead bugs. You need to do your bird dogs, or maybe glute bridges. So there's like that assessment of, or reminding people of where they're truly at. Yeah. Right. So it's just an assessment to see where people are at, how well they recover from things, and then go from there. Yeah. What would you say generally? So someone who comes into you and they need postpartum, like that one-on-one to get them to, because just for context, right? Like you're a coach at Rise, it's class form. You guys have HIIT classes and then strength classes, but then you also do one-on-one sessions as well, right? Yep. So what would you say generally, if you can give an estimate of how long would someone need that one-on-one before they can, or what are some because I guess timing isn't a great indicator because everyone's different. Right. What are some green flags that you would see when someone's asking you, when can I get back into class? I think it's when we can start loading them with a decent weight
Yeah.
throughout any movement I give them. So that could be squat, that could be some form of a deadlift, lunges, and they feel good through it and they recover well from it. Core wise, I want to see you in a good place with dead bugs, meaning you don't necessarily have to get your heel to the floor, but like it needs to go further than, 45 or maybe at least 45 degrees,
right,
or a little bit lower than that. What does your plank look like? And then just like, how do you feel after a workout?
right.
Do you feel sore for days? Are you exhausted? Like, how do you feel? A lot of the women that I work with, if I work with them prenatal and they come back postpartum, it's like 5 or 6 sessions.
Gotcha.
And they're
good to go.
pretty good to go. If you're a woman that hasn't trained and you're a couple years out of pregnancy, you're going to need more time.
Yeah. I think one of the biggest things, that I see is, oh my gosh, I have diastasis recti, like I can't do anything about it, blah, blah, blah. And, I think one of the things, like what I've learned over my specialization is that everyone gets diastasis recti, right? Like there is research that shows at 35 weeks pregnant, 100% of women have diastasis recti, right? Yeah. Now, that doesn't mean you can't do core work to help reverse it quicker or not have it affect you functionally as much, because when people come in, I've had some clients come in to me saying that, because they have that and they haven't addressed it for so long, that their core feels disconnected from their body, right? And that could be a symptom of diastasis recti, amongst other things, which, just for context, diastasis recti is the separation of the linea alba, which is where that rectus abdominis, that superficial layer of muscle, comes together. And I'm sure you do a lot of, core work in the beginning to help address that. Do you have women that are, that complain that like they're trying to prevent it, or like how do you kind of educate around that and like kind of take away the fear around that pregnancy and postpartum?
So I think for us, we're specific with our movements.
Yeah.
There's certain things you shouldn't do.
Yeah.
Like we're not going to start with sit-ups or crunches. We're going to not do Russian twists. There's certain things you just avoid and you don't do, and you start with super basic and you take your time building to a place where you can do those things comfortably. And for some women, it is worse. And that's, again, where I would say you need to go to a physical therapist, because I can't get you past this dead bug.
Yeah.
Like,
yeah,
you're just never going to comfortably in this space get past it. You need to go to a physical therapist that can do more for you.
Yeah.
In a more intimate way than what I can do for you.
Yeah. And a lot of it is managing pressure. Like what, because then people are like, well, why can't I do a sit up? Right. And it's like, well, if you can't manage pressure well and you can't engage that deep core, then you're going to get that coning, meaning pressure is going to come forward. Pressure might also go down, which might cause you to have leakage or pain, or we haven't really talked about prolapse, but symptoms of prolapse, right? So, it's just, and I'm sure you see this, I feel like it's understanding where you're at and what, like, accepting that, and what is a plan of how to get there, right? Can you continue with just training? Do you need training and physical therapy? Right. Because the goal is to get you where you need to be, but like you have to be realistic about where you're at in the process. Right. And it doesn't mean avoiding it or you have to do nothing, because I think there's a lot of fear around that. Like, oh, I can't work out because, I have diastasis recti, or I can't pick up my kid without pain or pressure. Right. And that actually means that you should be doing something, not jumping into like a group high intensity interval training. Right. But you should be doing some sort of training to address that, or else it's not just going to go away, right? And I think that's the biggest thing that people expect is like, oh, it'll just go away with time, and rest is great. And I'm just going to rest, and then, in 3 months, I'll pick it back up where I left off.
Everybody says, right?
Yes.
I hurt my back or I did that, so I'm just not going to work.
Yeah.
I'm not going to work out. I'm not going to train, but that's never the answer.
Yeah.
Not moving is never the answer.
Yeah. No, I totally agree. Okay, so let's talk about some common misconceptions, because I hear them a lot. I'm sure you hear them a lot. We see them all over the internet. What is the biggest misconception you hear from pregnant or postpartum women about exercising?
I think the thing I see the most is women holding back. There's a fear around movement and specific movements and how heavy they can lift. And so like one of the things I'll remind women, they'll be in their second pregnancy, and I'll say, well, if your child had your hands up right now, would you pick them up?
Yeah.
And the answer is always yes. So why do you think this kettlebell is too heavy for you right now.
Yep.
Because in the context of we're in a weightlifting room, suddenly that's too heavy. I bet your child is more than that. So there's just things of reminding women that like you actually can do more.
100%.
But I think, also being aware that there's just this innate fear. They want to protect their body and their babies throughout this. So that's a good way and a good analogy that they clearly understand. Oh, I do this. Or your bag that you carry to work probably weighs more than that.
Yeah.
Right.
And I think that's sometimes I have to check myself, right? Because when I'm, the yellow kettlebell, the typical yellow kettlebell is 35 pounds, right? And it looks big, but it's 35 pounds. Yeah. And a lot of women are lifting grocery bags. Yeah. They're holding both their kids at once, which is way more than 35 pounds, right? So if you're doing that, and you should be training even more than that, right? Right. Because one of the things that I've heard a lot about from a specific organization is 1 rep max living, meaning that, if you can go up and down the stairs once and that's all you can do, right? That's your 1 rep maxing essentially by going up and down the stairs. Our goal is to to get you stronger than that, right? So if you can lift both kids and hold them while doing something else, right? You should be training heavier for that. So then that's easy work for you, right? That doesn't make you sore the next day. That doesn't affect you. So I'm totally with you on, making sure that you're lifting heavy enough with the context of, your body, listen to your body. Don't do too much.
Right.
But, we want to make sure we're doing enough, because I think a lot of people in general, whether, they're a woman, they're postpartum, they're pregnant, they don't lift heavy enough, right? Oh, yeah. We're chronically underloaded society. So load is your friend with the right guidance.
Right, exactly.
I'm totally with you on that. And then do you find that there's any pelvic floor myths that you hear a lot amongst women that you train with, or just in the, universe that you're in?
I don't think I hear myths. I think I just see a lot of women living with incontinence.
Yeah.
Pelvic floor issues.
Yep.
Many of them. Because most of the women I work with are moms.
Yeah.
And so they're just kind of living with it.
Yeah.
And I think that's the biggest thing. And honestly, they all probably know they could do more. But like I said, it's just one more thing added to their plate.
100%.
So they just let it go.
Yeah.
And just deal with it, because I don't have to jump. I can avoid that. I can, squeeze my legs together. So I think it's not a myth. I think women are aware and they're just dealing with it. Yeah.
One of the things that I hear all the time is that Kegels fix everything. That drives me so crazy and we touched on it a little bit earlier, right? But a Kegel is a contraction of the pelvic floor. And that is important to be able to do that. And there's different ways that we measure that, right? Like, can you contract? Is the contraction strong? And how long, endurance-wise, how long can you hold the contraction? In a pelvic floor assessment that I do, I test all of those things. And you can also test them while doing functional movements to see if they're actually doing what you think that they're doing during that. Okay. However, as much as the contraction matters, can you relax all the way? So, if just like what I talked about earlier with the bicep, right? If you can contract your pelvic floor, if you can contract your muscle, but you can't relax it all the way, then your Kegels actually might be making your symptoms worse. Okay. A lot of times when people have incontinence, it's because they're holding in, they're so scared, they're clenching, they're tightening everything up so much, they're tucking their glutes, they're squeezing, they're thrusting their pelvis forward, and that actually can put more pressure on your pelvic floor, which can make the symptoms worse. So it's not necessarily not contracting, it's just how can you contract, can you relax, can you do all of the things, right? So that's one of the biggest misconceptions that I hear. If you're not challenging yourself in your strength, it's not strength. Just because you pick up a weight doesn't mean that it's strength training. And that might be where you start, but there's so much more to it. And I think having the right people and the right tools to help you guide you through that is so important.
Absolutely.
There's another saying out there that strong people are harder to kill, right?
Yeah.
And that obviously is like a very profound statement, but strong people are harder to injure. I don't like using the word injury prevention because stuff happens and you can't prevent everything, but it just makes you more resilient. And whether that's C-section is a surgery, right? So in a sense, so if you it's an abdominal surgery. Yeah. So, it's going to make you more resilient after, because inherently you're going to lose some strength, you know, postpartum, because you're like the main goal the first couple of weeks is just to rest. But if you're stronger before that, you're going to, like you said, your recovery is going to be so much easier. You're going to be able to do more with, if you have multiple kids, you know, or just if you're just having to get back to work faster, you know, like you're going to be more resilient and be able to do more. So I'm totally with you that it is the magic pill.
Yeah.
But it's also, I feel like the hardest thing, because especially as Americans, we want that quick fix.
Oh, yeah.
You know, and strength training is that thing that takes patience, consistency over time.
Yep.
You know, so you have to trust the process. And I'm sure you have those conversations so much with your clients.
Yes. Do you have a thing you'd like women to know? Prenatal, postpartum, any women you work with, do you have that thing?
I think strength training is definitely there, but to talk about something different than you did, I think use the resources in your environment, right? Like, don't be in a silo by yourself. I think postpartum depression and even pregnancy and depression, it's a huge thing. And like we talked about earlier, women just kind of like brush it under the rug because they're taking care of so many things, especially when you have a newborn, you know, that is your world, that's your focus. But there's so many resources out there, you know, there's therapists, you know, like talk therapy that you might need. There's your doctor, there's training, there's physical therapists. Like there's so many, like find your community and use the resources that you have in that community, because you're not alone, right? You know, you talk to one person and, you know, you find that something in common with them, that they're going through the same thing. And even that connection can help you feel like you're a part of something. You know, when I started working here at Next Level, I wasn't even starting to take on pelvic floor clients yet. And, you know, I had like 3 consultations and they were all for orthopedic injuries, but they all mentioned something about, you know, how they haven't addressed their incontinence for years. They can't run, they can't jump. They, you know, they're marathoners, but they pee themselves while they're running, or they have to stop their runs to use the bathroom. And, you know, it's everywhere. It's everywhere. So you're not alone. Like, let's stop normalizing it, right? Like, take care of it, take care of yourself, invest in yourself. So I think that's I know that was a lot, but I'm not one for using less words.
I think that invest in yourself.
Yeah.
It could be a short-term investment with long-term results, right? With longevity. So
100%.
To your point, make the investment and it'll pay off.
100%. I'm totally with you. Do you have any tips for men or partners to help their female partners that are pregnant during pregnancy?
I would say be there for them. If you have children, create space for your partner to be able to go train by themselves. I'm a big advocate for a woman, a mother, to not have to train with a baby on their back. And I know for some women that's all they can do, but if you have a partner and they can take care of those kids while you go out and you are able to focus on yourself and get every single rep in and talk to the person next to you and just really focus on taking care of yourself, it'll benefit the mother so much. So that to me is my biggest thing. Like, be there for her, give her, and if it's your first pregnancy, encourage her to go work out, make sure she takes the time she has it, or go with her to train. Just be a partner and really advocate for her to have her time to do some training.
I love that. I think that's so great. I agree with everything you're saying. I have nothing else to add. So the question was, for everyone listening, is would you rather wear cargo shorts for the rest of your life or not have to wear socks? I mean, I don't wear cargo shorts.
I mean, women wear cargo shorts, but I'm not one of them. I don't wear cargo shorts.
I'm not going to wear cargo shorts. So I guess I'm just going to have smelly feet. I don't know.
Yeah,
or blistered feet.
Sweaty, blistered feet. I'll take it.
Would you rather live in an Olive Garden for the rest of your life or be blind?
Olive Garden.
See, like I've never eaten at Olive Garden in my entire life.
It's all you can eat breadsticks.
But I'm gluten-free.
But would you rather not see?
True. I can just spend my time in the bathroom, I guess.
Well, they have other food. I'm sure they have gluten-free by now.
That's true. That's very true.
Meat.
Yeah, that's true.
They have other stuff.
I guess I'll just trust the process. my body will just adapt. It'll just adapt to this new life with the breadsticks. Yeah. And we'll do pregnancy and postpartum training in the Olive Garden.
Yeah. Yep.
I'm so glad we were able to talk about all of these things. We covered so much today. Where can people find you?
All right. So I work at a gym, Rise Fitness. It's local, just down the road, Bloomfield. Come find me there. We have several great trainers. I will take on postpartum prenatal clients. I'm on Instagram, Coach Sarah Jensen.
Love it. Yeah. We'll tag you in the details so that everyone can find you. And I'm Dr. Alex Hirsh. Again, you can find me on Instagram. Next Level, I work here at the Montclair location full time. And that's our podcast for today. Thank you so much for coming. We appreciate your time.
That was great. Thank you.
Yay.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to like, share, subscribe, or comment if you got at least one or two helpful insights or takeaways to help you get to your next level.